Hello and welcome. I'm Dr. Anwar Hussain, presently the Director of Institute of Palliative Medicine. Um, Today's topic is socioeconomic issues in advanced diseases. In this slide, I am trying to refresh the definition of palliative care by WHO, which you have been learning in the initial part of this course, which defines the different dimensions, multidimensional approach to a life-threatening disease and end-of-life care. In the definition, you have learned that any illness can lead to a suffering which has four dimensions: and physical, emotional, socio-economic, and spiritual. You will be learning each topic in detail. And today, as I have mentioned you, we are dealing with socio-economic issues uh, of a patient in advanced disease. There is a case scenario here. A 33-year-old David, a daily wages worker, has been diagnosed to have a carcinoma stomach a year ago. He underwent surgery and chemotherapy. After a brief period of improvement, he had symptoms of abdominal pain and vomiting and pain all over the body. Investigations revealed that his cancer has spread to many parts of the body and no curative treatment options are available. He's bedridden since that and needs support to move around and also for his daily living activities. He is on a catheter for passing urine. David has a 27-year-old wife and two children aged 8 and 4. My question is, how is his present physical condition going to affect his personal and family life? He's going through a very tough phase. He's in advanced life-threatening disease. So what is his disease? How is his disease going to affect his personal and family life? Second is, what all areas of his life or their life, including the family, their life will be affected. In the next few slides, we are going to discuss what are the social problems of David. Usually we don't think about the social issues of a patient because we mostly concentrate on his physical and mental pain problems. So in the next few slides, we will discuss about the areas of suffering he might be going in his social and family life. The one is his mobility issues. He might need assistance for everything. To move outside the house or to the toilet. For anything and everything, he needs an assistant and he is dependent. Next, he might need a wheelchair or a crutches or a walking aid to move inside the house. Third is, when he moves, he might get pain because of this disease. His movement might get painful. Second is the activities of daily living, like brushing, bathing, and eating, and any daily living activities will be severely affected by the disease and his present condition. Finance, of course, and he will lose his job due to the disease. He loses income, and maybe he's in debt or a loan is to be paid. So there are a lot of financial problem associated with a patient like David, who is very young and maybe the breadwinner of the family. The next one is education of the children. As you have seen, they are very young and they might be in their primary school level. So their education might get affected due to the illness of their father. And personal relationships with wife, children, relatives, neighbors, family, and friends. All this relationship might get affected due to the disease. And social activities, he might be isolated. He cannot go for functions, gatherings, parties, or he cannot visit his neighbors or family visits, and he can never think of going for a vacation, and all his social activities are at stake. Another very important area of suffering is his accessibility to good health care. Because of his physical condition, he is dependent on someone else to move out. So this delay might lead to complications of any simple and curable symptoms. For example, if he has a fever and urinary tract infection, he may not be able to reach in hospital in the right time, which leads to the complication of the problem. And again, in case of emergencies, he cannot be transported to the hospital at a proper time. And in the transportation, he will not be able to use the public transport system, and he had to opt for a private transport system, which is can get very costly. And again, he is dependent for his transportation, and his ailing physical condition again might be a barrier to his movement. His work, he might lose his work for his due to this disease, and he may be unable to work at home or do his job properly due to his physical and progressive disease. We have seen that David is from a low socioeconomic status. He is a manual labor, so his house may be small and lack the facility for a toilet inside, and he's on catheter, and due to the lack of space, his privacy also might get affected. And the next is a caregiver issue. That is, in this case, it is his wife. This is a very important issue which we have to deal because of the David being bedridden, 2 children. She might be lacking time in doing things like she has got a lot of things to do to take care of David, take care of the children, prepare them for the school, preparing food, washing. So she's have to squeeze time to give David a good quality of care. And the blame, yeah, of course, most of the time the wives get blamed for not being caring properly by the relatives of the patient, or from the society, or from even from the caregivers, blaming them for the lack of hygiene and lack of proper medication and care. And another thing is her physical condition might also get affected. She has to move David to the bed, or help him get out or walk. So she might get physical problems due to that. And of course, there are mental issues for such carers because of a lot of problems. David is going to die, and she has to go through all the pain David is going through, and also the future problems will get severely affected her mental status. And sexuality, again, another area which we didn't give much importance because of the lack of privacy and misconceptions regarding the disease spread. Some people believe that physical contacts will spread the disease, and physical strength and lack of interest. So these are the problems. I think there are 10 or 12 problems we have identified so far, and if you can go through in detail, we can identify more problems. So these are in brief the social problems, economic problems of a patient in an advanced disease. We have been discussing about the socio-economic problems of a patient with advanced disease, and the problems of his family. We have seen that the issues are very important, diverse, and intense. Now we have to find a solution, at least try to find a solution for such patients in our society, without which such patients might have a very bad quality of life in their last days, and eventually a suffering death. To prevent this, to give them a good quality of life, and good quality of death, we have to, as a society, as an individual, try to find solutions for these problems. So here is an activity which you will be divided into groups and discussing in the breakout room. Activity is how can you personally and your organization you work with can help David to overcome the social and financial problems we have been discussing so far. Just think how you personally and the people or the organization you work with can try to find a solution. Second is whom all you can, organizations, personnels, any government facilities, non-government facilities, in your locality whom you can seek to assist you in finding a solution of socioeconomic problems of people like David in their last days. So make it clear, the first part is how you and your organization can help David to come out of these problems. Second part is which organizations, personnel, facilities you can seek or assist you in helping people like David. After the discussion, you will be presenting, coming out of the breakout room, each group will be presenting what they have found and what they have discussed, and there will be a discussion with the faculty and a conclusion in the end. Thank you and all the best.